General survey. General survey is the overall review or first impression of the patient's well-being. This is done head to toe, lateral to lateral, proximal to distal, and front to back. General survey is a visual observation. Appearance. Appears to be reported age, sexual development appropriate, alert and oriented, facial features symmetric, no signs of acute distress. Body structure and mobility. Weight and height within normal range. Sits comfortably. Gait is coordinated. Walk is smooth and well balanced. Full mobility of joints. Behavior. Maintains eye contact with appropriate expressions. Comfortable and cooperative. Speech clear. Clothing appropriate to climate. Looks clean and fit. Deviations from what would generally be considered to be normal or expected should be documented and may require further evaluation or action, including a report and/or referral. Obesity. Obesity is an escalating global epidemic, substantially raises the probability of diseases like diabetes, heart disease, stroke, high blood pressure, and cancer. It affects virtually all ages, genders, and socioeconomic groups in both developed and developing countries. Distinction between being overweight and obese. A calculation called BMI breaks it down for us. BMI is equal to weight in pounds times 700 degrees divided by height in inches squared. Or BMI is equal to weight in kilograms divided by height in meters squared. Obesity is a condition of excess body fat that occurs when a person's BMI is above 30, while the overweight range is 25 to 29.9. Obesity is caused by energy imbalance. If energy input from calories is greater than energy output from physical activities, the body stores the extra calories as fat. Causes of obesity. Genetics. Some people appear to be genetically susceptible to weight gain and obesity. Engineered junk food. Stores are filled with processed foods that are hard to resist. These products also promote overeating. Food addiction. Some people experience strong food cravings. Aggressive marketing. Food producers spend a lot of money marketing junk food, sometimes specifically targeting children who don't have the knowledge and experience to realize they are being misled. Insulin. High insulin levels and insulin resistance are linked to the development of obesity. To lower insulin levels, reduce your intake of refined carbs and eat more fiber. Leptin resistance. Leptin, an appetite-reducing hormone, doesn't work in many obese individuals. Food availability. In some areas, finding fresh, whole foods may be difficult or expensive, leaving people no choice but to buy unhealthy junk food. Adults should be getting at least 2.5 hours of exercise each week and children a whole hour per day. But globally, 4 out of 10 adolescents aren't active enough. Once a person is obese, the time to recovery becomes progressively steeper. Hormonal and metabolic changes reduce the body's response to overeating. After losing weight, a formerly overweight person burns less calories doing the same exercise as a person who is normally the same weight. As people gain weight, damage to signaling pathways make it difficult for the brain to measure food intake and fat storage. As the world's population continues to slow down and get bigger, moving and consciously eating our way towards a healthier weight is essential to our overall well-being. And with the epidemic affecting every country in the world for different socio-economic reasons, obesity cannot be seen as an isolated issue. More global measures for prevention as essential to manage the weight of the world.
chronic condition which can track from child to adulthood and can result in a number of serious health conditions. It can also affect a person's well-being and quality of life, which can have an impact on individuals and their families. We know that at the simplest level, obesity is the result of an energy imbalance caused by consuming too many calories and expending too little. However, obesity is the result of a complex web of factors which influence our personal food and activity choices. Our choices are in turn shaped by the environment and society we live in. Obesity is mainly preventable, but we know that there's no simple solution. Cross-sector, system-wide action is needed to change the status quo.
Hypertension. Blood pressure is the force exerted by blood against the walls of the blood vessels. The pressure depends upon the work being done by the heart and the resistance of the blood vessels. Narrow arteries increase resistance. The narrower your arteries are, the higher your blood pressure will be. Over the long term, increased pressure can cause health issues such as heart disease. Types of hypertension. Essential. This type of hypertension is diagnosed after a doctor notices that your blood pressure is high on 3 or more visits and eliminates all other causes of hypertension. No symptoms, but you may experience frequent headaches, tiredness, dizziness, or nosebleeds. Although the cause is unknown, researchers do know that obesity, smoking, alcohol, diet, and heredity all play a role in essential hypertension. Secondary. When there is a specific cause for the hypertension. The most common cause of secondary hypertension is an abnormality in the artery supplying blood to the kidneys. Other causes include airway obstruction during sleep, diseases and tumors of the adrenal glands, hormone abnormalities, thyroid disease, and too much salt or alcohol in the diet. Drugs can cause secondary hypertension. Who are at risk? As we age, the risk of developing high blood pressure increases. Those with hypertension in their family history, being African or Caribbean, they are predisposed to having high blood pressure than other races. High sodium diet, lack of exercise, being overweight or obese. Causes of hypertension. Common medical conditions that cause hypertension. Kidney disease, diabetes, long-term kidney infection, obstructive sleep apnea, glomerulonephritis, hormone problems, lupus. Drugs that may increase blood pressure. Combined oral contraceptive pill, steroid medication, NSAIDs, some over-the-counter cough and cold medicine, antidepressants, recreational drugs such as cocaine and amphetamine. Pathophysiology. Stages of hypertension.
Although symptomless in itself, hypertension should be treated because it can damage the body's organs. The high pressure inside arteries stresses and damages their linings and encourages the buildup of plaque. Plaque makes it more likely that blood clots will form and block arteries. This can affect the brain, the heart, the peripheral arteries, the kidneys, and the eyes.